And then, as you all know, early this morning, out of an abundance of caution, CDC and FDA requested a pause in the use of J&J, Johnson & Johnson COVID-19 vaccine, as a potential adverse reaction is investigated. Out of the 6.8 million doses already administered in the United States, there are 6 reports of possible blood clots. I have Dr. Pearce, who is here, who can speak in more depth to that if you have any questions as it relate to it. In terms of the impact on the Health Department, City of Houston, as you know, the NRG, they were using J&J, but that switch has been made now, and so we're moving forward on that end. We had very limited supply of J&J already within our supply systems, and so we are switching over to Moderna. We primarily were using City Pfizer and Moderna, so we don't anticipate having to cancel any scheduled appointments for this week. So we will move forward. No scheduled appointments. Our supply was rather limited anyway, which is good in view of what has just taken place early this morning. So from the City of Houston's perspective, we're not anticipating any major disruptions. And as I indicated on Saturday, if anything, it will slow up how we ramp up, move forward. But in terms of scheduled appointments this week, people should still should go forward. I know there have been some questions as relate to people, for example, who received J&J this weekend. What should they do? I'm going to yield on that and bring up Dr. Pearce, who can specifically address those concerns.
Thank you, Mayor. Well, let me start off by saying that these complications, these blood clots, appear to be extremely rare. As the Mayor said, 6 cases out of 6.8 million doses have been given. So those are extremely rare. That's literally less than 1 in a million. Nevertheless, the type of complication is called, it's a big long name, central venous sinus thrombosis. And it is a clot in the brain, and it is difficult to treat. They are very rare to begin with. And so one of the questions that the FDA will be addressing is, with these cases, is this more or less than we would have expected to see in a population that size anyways? And so we'll be hearing from the FDA on that. Now, further complicating things is that these clots are generally treated with a drug called heparin, which is a drug that has been around for many years and is very generally considered to be very safe. But in this case, the early data, again, something the FDA will be looking into, it appears that the heparin may actually complicate things. In terms of folks who have already been vaccinated, it appears that the window, if you're going to have trouble, is somewhere between 1 and 3 weeks after the vaccine was given. And the cases that have the FDA and the CDC most concerned are the cases of blood clots in the brain. But to folks who have received the J&J vaccine, first of all, number one, again, it is extremely rare. This complication is extremely rare. The Department of State Health Services for the state of Texas tells us this morning that none of these cases that we know of are in Texas. So apparently none of them have happened to any Texas. I just got that just as I was waiting from the Department of State Health Services. The other thing, though, is that the particular complication we're worried about right now is a blood clot in the brain. But you need to know that people can develop blood clots elsewhere in their body. So the current recommendation is for folks that are less than a month from their J&J vaccine, if you develop severe headache, shortness of breath because you can get blood clots in your lungs, if you get abdominal pain because you can develop blood clots in your abdomen, or leg pain because you can develop blood clots in your groin, basically, that can be really serious, that if you have any of those symptoms, you should reach out to your primary care provider and be evaluated. Again, I want to sort of bring it back to where I started. This is extremely rare. The cases that the FDA is looking at are a particularly serious complication. But nevertheless, I think one thing for people to recognize here is that we are fortunate that there are systems, and there's not just one, there are multiple systems in place such that an anomaly that occurs in 6 out of 6.8 million people gets on the radar. So I think that speaks pretty well to how strong the filter is to try to catch those things. Mayor?
And again, before we take questions, I want to emphasize, again, 6 out of 6.8 million. I want to emphasize that because I know when people are hearing things and people just took, for example, J&J over the weekend, there they're nervous, they just don't know. So I want to emphasize that. 6 out of 6.8 million, none of those 6 persons, for example, in the state of Texas, as far as we know. And so that's good. And then bear in mind, if you're outside of, let's say that 2-3 week window, if you're outside of that, if you got this vaccine, for example, in early March or in February, then you are fine. And then at the same time, I still want to encourage people to get vaccinated, take advantage. With the city of Houston Health Department primarily uses Pfizer or Moderna, okay? Those are the 2. And the good news is that we still have these other vaccines that we are still using, and they work and they are effective. And then bear in mind that the variants are still very much present here in the city of Houston, and you still need to get vaccinated. So I don't want this to slow down people going to their scheduled appointments. Please go to your scheduled appointments. Please get vaccinated, okay? Please get vaccinated. Because what we do know, like yesterday, I think I reported 12 people who died from COVID-19. That's yesterday, 12 people. And if you look at the reports, the daily reports, there has yet to be one single day where I have not reported somebody dying, several people dying from COVID-19. I would be more fearful of getting COVID than getting vaccinated, okay? So let me encourage people to still get vaccinated in the city of Houston. And then the other point that I want to make, one of your best protections against catching this virus has been something that we've been using since March of last year, and that's these masks, okay? And that's why it's still very important to keep these masks on. And as I look around in this room, almost 99% of the people in this room have their masks on. And that's the importance of wearing and keeping your mask on. Okay, that's your protection, and these masks work. And quite frankly, the only major problem from a mask is just the inconvenience. Okay. Okay. Having said that, we can take any questions that you may have.
Mayor, question for both you and Dr. Bird.
Sure.
The concern you have, I hear you urging people to continue to get vaccinated. What concern do you have that this will only amplify the hesitancy that already exists, particularly in the most vulnerable communities?
I'm concerned, and that's why I'm stressing the fact that out of 6.8 million people who have taken the J&J, we're talking about 6 cases out of that 6.8. And that's why I'm also encouraging people. For example, there's been a pause on the J&J as they do their due diligence, and I appreciate that. And there are several checks in the system to make sure that these vaccines are safe. And I want to encourage people to still go to their scheduled appointments. The city of Houston primarily uses Pfizer or Moderna, and primarily Moderna is the one that we use. So, I took the Moderna, fine. And quite frankly, most people, the overwhelming percentage of people that took either one of these vaccines is fine. So I don't want people for people to say, okay, we're not going to take any of these vaccines. We're just not going to do it. The reality is, every single day, going way back to last year, I have reported a number of cases where people have died every single day, okay, in my reports. And people are still getting infected with this vaccine. And so, I would be more fearful of the virus than I would be of taking the vaccine. So let me encourage, especially in communities of color, African Americans, Hispanics, Asians, and others. Let me encourage you to get this vaccine. It will keep you out of the hospital, can keep you alive, and can put you in a better position where you can start socializing with your family members and friends. Sure.
Good questions. So, I do agree. When we look at the numbers, the mayor pointed out, and anybody can do this. So I've been, and I invite you. I'm going to give you a little back of the napkin math, and I invite you to go ahead and fact check me on it, because it's back of the napkin math, okay? But if you look at the number of cases of COVID we've had in Harris County or the city of Houston, and you divide into that the number of people hospitalized, just those numbers, it's about 10%. Now, that's a way overestimate, because not everybody who gets infected gets tested. So let's take that 10%, let's cut it in half, make it 5%. Let's cut it in half again, make it 2.5%. And then tell you what, let's take a little bit more off of it just because it makes my math easier. Let's say it's a 2% risk, just for the sake of discussion. Well, that's 1 in 50. 2% is a 1 in 50 risk. If you then look at the number of people who get hospitalized and the number of people who die in the hospital, well, that's about a 10%. And those are hard numbers. There's no fudge factor there. That's solid numbers. So if I get infected, I'm running a 1 in 50 chance of getting hospitalized and then a 1 in 10 chance of dying. With the vaccine, when we look at Moderna and Pfizer, and again, fact check this, the complication rate in terms of the anaphylactic, the serious allergic reaction, is literally about 1 in 100,000, for which somebody's right there to treat you and get you through it. So I'm taking my chances with the vaccine any day. And now here with the Johnson & Johnson, we're really looking at a complication, a very serious complication, but it's literally less than 1 in a million. So I really applaud the FDA and the CDC for two things. Number one, having such a fine filter that they could catch such a rare anomaly. And number two, being responsible in asking that we halt things until they can find out what is really going on. Now, we may find out in a couple of days from now that, hey, you know what, there's really a problem. Or we may find out a couple of days from now, nope, this is exactly what we would expect naturally to occur. And there really doesn't appear to be a problem, or somewhere in between. So I think that the FDA and the CDC are being very responsible. But to the early part of the question is, I do fear, and I agree with the mayor, I do fear that this will add to the dialogue of problems with the vaccines when there really aren't, I shouldn't say there aren't any, but they are very rare. And again, you know, when we compare it to the risk you take when you get infected versus the risk you take with the vaccine, the risk is way favors the vaccine. And the other thing is, we live in a world of risk. So we're here today talking about making the safe streeter. So you take a risk every time you get on a bicycle or you get in a car or you get in a plane. Or we take risks all day long. So the risks with the vaccine are extremely low compared to the risk that we get with if we get infected. And we don't live in a world where there's no risk, right? I mean, unfortunately. So there is no such thing as a no-risk vaccine. It's just which is the greater risk.
At what point does this start to affect your ability to routinely vaccinate people and have available supply?
So, as Mayor said, so right now, minimal impact because there is minimal amounts of Johnson & Johnson vaccine. In fact, right now, we basically don't, the City of Houston Health Department basically has, I believe we have none, or we have almost none. So for us, today, it's not going to have an impact. Now, we were anticipating getting more coming in. As the mayor said, we want to ramp things up. We want to make more vaccine available to more people. So that's where it's going to impact us. And we're going to have to wait and see what the final decision is about using Johnson & Johnson moving forward. The more people we get vaccinated, the more quickly, the illness drops. But the other part is, somebody mentioned earlier the variants. Well, every time somebody gets infected, there's a chance of a new variant. So we want to stop this virus as soon as possible before it creates a variant that gets around and either makes people sicker or it somehow is impervious to the vaccine or whatever problem that it will bring with us. So the push to get people vaccinated remains. For us, the City of Houston Health Department, this interruption is going to have minimal impact today, but it does impact us as we move forward and try to ramp things up. Just slow that down a little bit. Yeah, so that'd be a question for Stephen Williams. He could give you the numbers and tell you exactly. Yes, sir.
How do you allay the fears of those who've already gotten the vaccine and within that community that you touched on?
Right.
What do you say to those people who have fears about it?
So the people who have already gotten vaccinated? Yeah. Yeah. So what I would say to the folks who have been vaccinated with Johnson & Johnson and they're within the 3 to 4 week window, I would say, number one, this is extremely rare. 6 out of 6.8 million, less than 1 in a million chance. That's number one. And number two is, should you develop severe headache, shortness of breath, severe abdominal pain, or leg pain, then you need to reach out to your primary care physician and get yourself evaluated. Clots are treatable, and so even if you should develop this complication, they are treatable. So in the case of the 6, there are 6 cases. 1 person has died. The other 5, at this point, as far as I know, and remember, this just came out this morning, so I'd like to get more detail. But the other 5, I don't know if they're over it or if they're being treated, but it's been 1 death. The other 5 have not died. So clots are treatable, And if you think you have one of those clots, you need to reach out to your doctor and get evaluated.
And let me just say, number one, I appreciate the CDC and the FDC for pausing and take a look at it, because it's important for all of us to be transparent. I'd rather for them to make the information available and to give people a confidence that that the checks and balances within our system, those checks and balances are working. And then again, to put things in perspective, we're talking about 6 people who have had complications because of the J&J vaccine. Compare that just in the month of April alone, in the city of Houston, just in the month of April, more than 50 people have died from COVID-19. Now, I want you to put that in perspective. 6 people, complications out of 6.8 million, 1 person having died, 6 people. But in terms of COVID-19, the coronavirus, just in the month of April in the city of Houston, more than 50 people have died from COVID-19. Okay? And the variants are very much still in our city. So let me encourage people. Let me encourage you, go get vaccinated. The good news is that we have multiple options. And so you've got the Pfizer, you got the Moderna. Please take advantage of that to protect yourself, your family members, and your friends. Okay? Yes? Sure.
They're asking, seeing how the state has been opening up since the last month, with concerts and public events being scheduled, what options do you have to cancel, suspend, or limit events, and what conversations did you have with concert promoters about that issue?
Well, pretty much, I mean, the state has opened things up. And, with regards to city facilities and events, those things that I can control, we've been operating on a very phased-in approach. And so we've been phasing things in. As you know, our parks, for example, we are now allowing Little League play. We returned the rims on the basketball courts. Soccer games are starting. So we have phased things back in. What I would say to people is that at this point, personal responsibility is critically important. And that's why I want to acknowledge, if you go around the city of Houston, I'm pleased to report most people are still wearing their masks. And that has helped quite a bit. That's helped quite a bit. And so if you're in a mass gathering, for example, if you're at an event, I would encourage you to wear your mask. But in terms of whether or not, as mayor, I'm going to step in and just attempt to cancel events or things of that nature, no, I'm going to let you, people will have to exercise their personal responsibility now that the governor has opened things up. But I'm going to continue to wear, if I'm around you, I'm going to wear my mask. Okay? Hold on, I'll be more than happy to talk to you in a little bit. Okay? All right. Thank you all so very much. Okay? And I'll be more than happy to talk to you. The other